Coronavirus. Now that I have your attention, I would like to introduce to you revolutionary technology of bacteria and INSTA-OT wipes. It's a shame that it's taken so many lives and so much devastation world over and so much panic for people to appreciate the benefits of proper infection control. I would like to introduce INSTA-OT wipes, a box of 10 wipes that provide you up to 24 hours of disinfection with just a single wipe. At the end of the day, safety is just a wipe away. Now, what happens is that aerosols are the primary spread, a mannerism of spread of droplet-based infections, such as coronavirus, the common flu, and other infections. These aerosols suspend or hover in the air around us. Slowly, these infections settle down on surfaces and create what is known as formite-based infections. These infections are often the sources of cross-contamination and build up with time in order to create what we call a reservoir of infection. Now, let us understand the role of aerosols. Aerosols are one of the most common ways in which droplet-based infections or viral infections such as the common cold and coronavirus are spread. These aerosols remain suspended in the air around us for a couple of hours. But with gravity and with time, they settle on the surfaces. This leads to the development of infected surfaces or what is known as formite-based infections or inanimate objects that then help transfer the infection and create a route of cross-contamination. This is known as the reservoir effect and is most commonly seen in public spaces such as offices, hospitals, clinics, as well as metro stations, airports, and workspaces, etc. Coronavirus as well as other viruses have been shown to last for as much as 72 hours on surfaces such as plastic, metal, as well as cardboard. Cardboard seems to be suspended for as much as 24 hours. This is according to the Rocky Mountain Institute in Colorado. What INSTA-OT does is that it forms a strong substantive coating on these surfaces, whether they be metal, glass, cardboard, wood, or steel, including fabric. This surface protection then physically kills the bacteria or virus as soon as it comes in contact, and the substantivity due to the organosilines present actually leads to an action that lasts for several hours. This actually inactivates the aerosol that settles on them and does not cause the volatilization as you see with alcohol-based scrubs. Now, in order to understand whether this actually works, I'd like to demonstrate what ATPase testing is. These are tests that are carried out in order to understand the amount of ATP on the surface. ATP is the building block of life and hence is present in bacteria as well as viruses, and what the procedure does is that it takes an FDA approved hygienometer and we swab the surface, and once the surface is swabbed, we get a reading of exactly what kind of bacterial load is present or biofilm is present on the surface. As you can see demonstrated clearly, with one wipe of INSTA-OT, within 10 minutes, we reduced a reading of 700, which is an extremely contaminated reading, all the way down to 0. When we look at regular places around us, we can classify them into critical, semi-critical, and non-critical areas. Critical areas are areas where we experience a lot of elderly people as well as immunocompromised people which need an excessively high level of disinfection. This includes clinics, ICUs, pediatric wards, neonatal ICUs, etc. In areas like this, we recommend that a wipe be performed once every 24 hours. Second to that come to critical areas, semi-critical areas. Semi-critical areas are areas where we do not regularly have immunocompromised people, but we do have areas where healthcare is being provided as well as immunocompromised people may come into contact either indirectly or directly. These include objects and furnitures in hospitals, clinics, workspaces, areas where there is intimate contact. Non-critical areas are areas that are exposed to the general public, such as remotes, glasses, gym equipments, mobile phones, laptops, door handles, lift handles, etc., as well as workstations. We have seen that our chemical coats this surface for up to 5 days in the case of non-critical areas. The use of INSTA-OT wipes will reduce infections, pain, and swelling in a clinical environment. It's extremely effective in dental clinics, minor OTs, ENT setups, radiodiagnostic setups, ophthalmology clinics, labs, etc. In the case of personal usage, provides 24-hour protection in non-critical as well as in non-critical areas as much as 5 to 7 days of reliable surface protection in order to protect your families. The interesting thing about the chemical significance of bacteria and INSTA-OT is that the process of killing is physical. and this prevents the development of resistance. INSTA-OT wipes would ideally be essential for the usage on phones, stethoscopes, handrails, elevator buttons, and other personal belongings that harbor contagious bacterial or viral infections. And INSTA-OT wipes can significantly reduce your exposure to viral infections. How it works is extremely simple. Pick up a swab, rip it open, swab the surface of your choice, wait for 2 minutes for it to dry, and you're ready to go. Your site is now protected for 24 to 48 hours. This is safe, easy, quick, effective, long-lasting surface disinfection. With INSTA-OT and Bacti barrier, safety is just a wipe away.